Okay, well, good afternoon, everyone that's joining us and will join us on the YouTube. This is our final webinar series for this spring, talking about small ruminant parasitology. Today we have Dr. Navarre, and she serves as the statewide extension veterinarian for Louisiana, for LSU, and for the LSU AgCenter. And she's going to be talking a little bit more about some integrated parasite control strategies and management and record keeping. And so, Dr. Navarre, thank you for coming on today and having joining us. And so I'll let you take it away.
All right, you're welcome. I'm glad to be here. So as Tyler said, I'm Christine Navarre. I am the extension veterinarian. I cover the state for Louisiana and travel internationally and all throughout the United States. And finished at LSU vet school in 1990. So I've been practicing and I've done mostly ruminants my entire career. And of course, when you do small ruminants, parasite control is really, really important. So I've got some experience there, and it's one of my favorite subjects, parasites. So we're gonna go from there. So what we're going to do today is try to put everything that we've covered in the last three webinars, and they were all great. And I'm going to kind of, as we put things together, recap some of the key points from previous speakers, also add in some things about diagnostics and record keeping, and then again, try to tie everything together for us today. So we know that, from one of the previous speakers, really what we're talking about is Haemonchus contortus if you're talking about sheep and goats in the southeast. And I may say goats because that's most of my experience, but really, unless I specify, what I'm saying applies for sheep and goats too. We know it's a bloodsucker, so those animals get anemic. That means they get pale. We know that those adult females are highly, highly prolific. And so our pasture contamination gets really, really, contaminated very, very quickly. It also has a very short life cycle. And so once we have eggs on that pasture, they develop into larvae very quickly. Those larvae get picked up and then develop into egg-laying adults very quickly. And they are going to be most impactful on weak animals, young animals, pregnant and lactating. We know that goats don't really develop as much age-related resistance as sheep do. And then we have a very long transmission season in the southeast. So the environmental conditions that are ideal for Haemonchus are there for a big part of our year. So it's really, really important there. And then we have resistance to all classes of dewormers. And so you saw some of that presented. And, so we really have to figure out how we're going to deal with this long term in each individual operation. So as we said, goats acquire really only partial immunity. Goats are supposed to be browsers. And so from an evolutionary standpoint, they really don't know how to develop an immune system because they've never been grazers. We've kind of turned them into grazers here lately. Immunity is slow to develop in sheep, but it does develop. Kids and lambs are highly susceptible. And we also know that there's that periparturient rise in eggs per gram because the immunity around kidding and lambing goes down. And so those animals are a little bit more susceptible to clinical disease, but they also are going to contaminate the pastures for those babies a lot more when they're around kidding and lambing. Any type of stress. So our goal with any livestock operation is to look around and go, all right, what are all the things that could stress these animals? And we're going to try to either eliminate them or we're going to try to minimize them. So pregnancy, lactation, weaning, nutrition is huge. Dr. Lemus's webinar was full of really good information, and really, really important that we keep the nutrition on these animals for a lot of reasons, but that helps them with the parasite control. Transportation, we live in the Southeast, so heat stress is something we're not going to eliminate that, but we have to, mitigate that as much as possible. Shade, fresh water, things like that. And then parasites in turn impact the immune system in response to other diseases and vaccines. So, they not only take advantage of low immunity, they will in turn impact the immune system. So, goats were never really intended to live and graze in a warm, humid climate. And so that's a problem when, we are trying to raise these animals and actually having them be grazers. So we need to think about that, and provide browse as much as possible for those animals can really, really be an important tool in managing our parasites. So our traditional approach to parasite management has really helped increase our anthelmintic resistance. So we have treated the entire herd, we've dewormed frequently and by the calendar, we've rotated dewormers regularly, we've had everything in one pasture, we've, either overcrowded or, overgrazed. If we have multiple pastures, and this was something we recommended for years before we knew that it was the wrong thing to do, was we dewormed and then moved things to a new pasture. And we know that what that does, or a clean pasture or low contamination pasture, and we know what that does is just all we have are resistant worms that come out of those animals once we do that, if we deworm everybody to contaminate that pasture. And then we unknowingly purchase resistant worms. So as, operations that, had some resistance build up, had a dispersal sale, and then animals went everywhere, that became a problem. So managing parasites, given that resistance is inevitable and resistance is forever and no new products are on the horizon, we have to think about it in a little bit different way. So what are we going to do with those animals? So we have animal management. We have to do diagnostics to know what we're actually dealing with. We're going to treat individuals and not herds. And we're going to do smart drenching. We'll talk about that a little bit, and use alternative treatments where we can. Again, minimizing stress is really important for a lot of diseases. And then ultimately, we would like to select parasite-resistant animals. Now, that's going to depend on if you're a commercial or a show goat producer, show sheep producer, registered animals, purebred animals. So we'll talk a little bit about that at the end. And then we have to think about pasture management. Again, Dr. Lemus did a great job of that. And then we have to have records so that we can monitor things over time. So which parasites are present is really important to know. For the most part, we have Haemophilus, but if we see things that are out of the ordinary, then, if we're seeing bottle jaw, if we're seeing a lot of diarrhea, then we need to figure out what those parasites are present. We need to know when they're being transmitted, and then we need to know which anthelmintics, even though we have resistance is kind of a sliding scale. So technically, when that anthelmintic is, less than 95% effective, it's considered resistant. But if it's still 80% effective, we can still use those products, but we need to know which products we can use in combination and what to expect. So diagnostics, again, the number of parasites. We're going to look at quantitative fecal egg counts, and that is going to be either a McMaster's or a mini FlowTac. To do those at home, you'll have to have a microscope to look at those, but they're pretty easy procedures to do once you're trained at what to look at. We need to get these results in eggs per gram. So, in your small animal clinics, they'll run fecals on dogs and cats and just say, yes, we have this, yes, we don't have that. But it's really important that we get eggs per gram and get those samples from the rectum. They need to be really fresh. And then once we collect those, we want to keep them cool. We want to put them in a plastic bag with no air. We want to squeeze out all the air, and then we want to get those to the lab very, very quickly. One of the things that is frustrating for me and everybody is one-time fecal egg counts are really not good at determining when to treat. So I get calls all the time, whether it's small ruminants or cattle. I have eggs per gram and they're this is the numbers. What do I need to treat or not? And unfortunately, there's so many things that it can impact that number, and that a one-time number doesn't really tell us anything. So what we need is patterns over time. So we know that, okay, we've been doing this. This is with, what happens with our pastures. This is the weather. These are the numbers. And then if all of a sudden something, is out of pattern for that operation, then we have a much better idea of what we need to do. So parasite species. So if paleness or a high Fibonacci score is a major sign, then Haemonchus contortus is likely, although we have to make sure we don't have some other diseases that can cause anemia. Again, if you start to see diarrhea, you start to see bottle jaw, then we want to check the species. And what we do there is you turn in some fecals into the lab, and they actually hatch the eggs out and then look at the larva, and they can, because you really can't tell the difference. All the eggs look the same, but once we get the larva, they can speciate those larvae and actually quantitate those and give us a better idea of what we've got. And then the level of resistance. So we need to do a fecal egg count reduction test. There is a drench right test that's a laboratory. You send the fecals in and they will tell you not only what species of parasite you have, but what the level of resistance is in each one of those. And so it's kind of a one-time thing. It's not cheap, but when you compare it to what you have to do on the farm, it actually can be pretty comparable cost-wise. And so what we have to do there is, if we're not doing the drench right for the fecal egg count reduction test, we take fecals at the time of deworming, and then we repeat those fecals 2 to 3 weeks later, depending on the product that you're using. And the good news is, so that's very labor intensive. You got to get fecals, you got to turn those fecals in. We can do some composite samples to help with the cost there. But, then you've got to get them back up, and then you have to decide, do I do each, dewormer class separately? So in one of the previous webinars, they talked about the classes of anthelmintics. Or am I going to do some combination? So, you're going to be doing multiple of these to get a baseline of where you are with each anthelmintic class. The good news is if you have a relatively stable herd, you've got a bunch of, user does, and, there's not a lot of changeover, then you don't have to do that, every year. You can wait every 2 to 3 years, again, depending on the situation. If you're, moving a lot of animals in and out, then that's going to change. And so you're going to have to do that more often. So again, lots of different decisions to make there on how we're actually going to do it, but pretty labor intensive, but we've got to have that information so that when we do decide who we're going to treat and they need to be treated, we can actually do that effectively. So the concept behind selective treatment, the parasites are not equally distributed in groups of animals. So about 20% of the animals harbor about 80% of the worms. And so, a minority of the herd is responsible for most of the egg output. So in the long term, if we find those animals, and ultimately what we've got to do is cull those animals, then, then we have a lot less problem. And FAMACHA, we'll talk a little bit about. FAMACHA is really a system. It's not a decision to treat or not. It is a culling tool. And if you actually use it that way, you can develop a very parasite resistant herd if we start to cull the ones who are continually problems. So FAMACHA, again, is our selective treatment tool for Haemonchus contortus, that is only. For other GI worms, you know, you've already heard about the 5-point check. So we are going to track fecal egg counts. You know, maybe quarterly is always good, and young animals, get some samples in young, get some samples in older. Looking at body condition score, making sure we lay our hands on those animals, you know, especially if you've got, you know, sheep with any wool layers on them, you've got to put your hands on them. What is their production level? Are they lactating? Are they growing? And then in the short term, we can look at, and especially for young animals, we can look at weight gain. Weight gain in adults can be a little bit tricky because of, you know, they have a huge rumen, and when they take a big giant drink of water, it can change the weight quite a bit. So body condition scoring is actually better in adults, and weight changes are better in those young. So a few precautions. Again, FAMACHA is only applicable when Haemonchus is the main worm. And so yes, in the Southeast, that's what we're dealing with, but we just want to make sure that we're not missing something else. Remember that conjunctival redness, so that low FAMACHA score could be caused by eye disease. It could be caused by wind. It's been super windy this spring, and so if you're doing FAMACHAs out there, you want to look at those eyes super quickly and then boom and move on. We always want to look at both eyes. And then paleness, if you have a high FAMACHA score, we have to look at other things. And so I've seen some herds with lice, and if it's a sucking lice, they can get anemic from that, and they'll have it'll change their FAMACHA score. So when I'm looking at those eyes, I'm also looking at the whole animal. And again, we're not using this as a sole criteria for whether or not to drench. We're looking at all these other signs, and if we see something else, then maybe we need to go ahead and drench those animals. We just need to keep track of it. So this is a really beautiful tool. This will come when you get FAMACHA certified. You will get one of these. And what we have over to the left, this is the date that we did our FAMACHA scores. And so it's across the top are the categories. So you can see every dot represents an animal. And then over on the right side, we just have those totaled up. But you can actually see, and this is very, very typical of what happens as we get into May, you know, April and May, when things start to warm up, Haemonchus gets even happier than it was. And it starts to multiply, our life cycle starts to shorten up, and we get a lot of contamination out there, which means we get a lot more parasites. And you can see that these FAMACHA scores are taken about every 2 weeks. You can see that we are starting to shift from very low FAMACHA scores, which means things are good, to high FAMACHA scores. Now, this does not tell me which animals are impacted, which animals have which score. I still need to track that. But this is a beautiful chart here that says, okay, I'm starting to get more 4s. Now I've got a 5. I probably need to start checking FAMACHA scores more often, and I may have to treat things just a little bit differently. So if less than 10% of the herd or flock scores in categories 4 or 5, then every 2 weeks is probably okay. During the cooler season, you know, you can get away with every 4 to 6 weeks, but this is where you really learn your herd. So, you know, as you learn what happens on your individual operation with your genetics, then you'll be able to you know, to flex this a little bit. Once we get over 10%, in categories 4 and 5, we need to start rechecking weekly, and then we might start to treat threes. And if they're currently on a pasture that you think has got some contamination, then the moving pastures might be a good idea. But we also need to keep individual records, because what I ultimately want to do in a commercial herd is those animals that consistently score 4s and 5s, those are the ones that need to go. And if I get rid of those, if I call them, your parasite problems will get significantly better. You will not have to do FAMACHA scoring as often. You'll have to treat less. And so it's a really beautiful system to be able to figure out who to keep and who needs to go down the road. Again, FAMACHA is best used as a culling tool, not just a treatment tool. If you're just using it as a treatment tool and you are continually, even though you're going to knock back the worms, when you treat those high shedders, they're still going to shed. They're going to bump back up very quickly. And every time I treat one, I am promoting resistance, which just goes further and further down the line to not having any products at all, because we know that there are no new products, at least in that we know. So using it as a culling selection tool is really, really good. So components, how do we know who to treat based on our FAMACHA and making sure we're treating anything else that looks like it needs it. And then how are we gonna exactly do that? So again, I need to know my resistance pattern on my particular operation so that I can pick the right combinations. I'm going to make sure that I administer the proper dose. I'm going to use some physiology to maybe help those dewormers do a better job, even if I have some resistance. We'll talk about that. Again, selective treatment, and then using those non-anthelmintic treatments that you've already heard about, copper oxide wire boluses, bioerma, you know, grazing with something like Serratia lespedeza. Those sorts of things can really help. So proper technique is very, very important. We have to deliver these oral products over the back of the tongue. It's critical that the full dose lodges in the rumen. And if we just squirt it in the front of the mouth, what happens is there's something called the esophageal groove, which then bypasses the rumen. And we want it to stay, in the rumen. And then one of the things that we can do is, if we have a place to dry lot these animals, and I believe that every small ruminant operation needs a dry lot, because even when we select, over years, we select animals that are parasite resistant through FAMACHA, there are years, drought followed by heavy rains in particular, where we can get some really, really high pasture contamination, and even those resistant animals may need treatment. And getting them off the pasture in those cases is sometimes the best thing that we can do in the short term. And so I like having a dry lot all the time for emergency situations. But also, when I do treat, if I restrict feed for 24 hours prior to my first treatment, and then I repeat the dose in about 12 hours, that can really increase the efficacy of those drugs. Again, we're never going to have late pregnant animals pulled off feed because of the risk of pregnancy toxemia. But especially in your young animals, this can really, really make a difference. Remember, as long as they have a rumen, restricting their feed, they've still got a rumen full of feed, so it's not like they're gonna starve. So this can be a really, really good tool. And then we're going to use combinations, and one of the reasons for that is that just leaves fewer resistant worms, but we're never going to do that if we're treating everybody. because that is just going to lead to multi-drug resistance and it'll be widespread. Um, Again, we've got to build that refugia into the system, and we have to monitor the effectiveness over those drugs every few years. So what about pasture? And so again, Dr. Lemus did a great job of covering some really, really important information. I believe if you manage your pastures correctly and manage the nutrition, you're going a long way into fighting all kinds of diseases. But we know that really there's so many things that impact how many parasites we have on the pasture. And some of these we can't change. Um, and the weather is constantly changing. So you have this beautiful plan, and then you think you can predict what the parasites are going to do, and then the weather changes and it throws a wrinkle. So what I tell people is let's manage our pastures for whatever is out there for the health of that forage and the animal nutrition first. Because if we do that, then we've gone a long way in helping those animals. Because again, nutrition is the number one thing that we have to take care of first for any health program. It is number one. And then we're going to monitor diagnostics. We're going to do those egg counts quarterly, 3-4 times a year. And we're going to monitor animal health and production over time, and then we can refine that program over time. So that's kind of how I really approach pastures and parasites, but a couple of cautions. So so stocking rate really is based on grasses. So what can the grass handle? And so even if you are not overstocked based on what the grass tells you, you can still have deadly buildup of parasites. So again, we have to use some of those, not cookbook rotation schedules. If anybody says, well, if you just rotate this every day, this many days, you'll be fine. That's a very dangerous recommendation because it's highly, highly variable. Again, it depends on the season, the age, the immunity of those animals, everything. Again, write everything down. Keep records of your grass height, when you graze, when you moved, animal health, production records, egg counts, weather conditions. All of that will help you predict what's going to happen later on. Multi-species grazing. So in theory, this sounds great, but there was a review of this and presented at Animal Science a few years ago, and there's really not a lot of great data that it actually helps on the parasite side. And I would tell you that calves are susceptible to Haemoccus contortus. So I am not a big proponent of grazing cow-calf pairs with small ruminant pairs. If you've got some, aged adult dry cows, then that might be okay because they should have immunity. But I'm not going to graze anything under 3 years of age, really, and especially calves anywhere there's Haemoccus contortus. Even in, again, well-designed grazing system with parasite-resilient animals, some years can be deadly. So, again, have that dry lot for emergency use. So, kind of the bottom line, it really depends on what type of animals you are raising, is how far you can go with parasite control and selecting animals that are parasite resistant. So there's something called nutrient partitioning, and what that is, very simplified version of that is, an animal can only eat so much. And if those animals' genetics tell it to grow, 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 which a lot of our really successful show animals do, there's nothing left over for the immune system. The immune system relies on nutrients. And so if there's not enough nutrients left over because those animals are using them all to grow, we don't have a great immune system left over. And that applies to a lot of diseases. And so the further away we get from hybrid vigor, so when we have purebred, or especially if we start line breeding, that can really impact our immune system. And again, those are really growthy animals. And so they can be really difficult to maintain on grass at all, because there just doesn't take very many parasites at all to push them over the edge. And so again, using a dry lot situation is something that we need to have as part of our armamentarium. And then commercial animals, again, what I'm going to want to do is have crossbred females that give me some hybrid vigor, and there's everything in between here. So, again, it really depends on your goals, and we can make everything work, but you're going to have to make some pivots. There's no magic bullet. There's no magic shot. I'm going to use those crossbred females, take advantage of hybrid vigor. I'm going to use Famantia to, in the Southeast, mostly Famantia, to select, who is going to stay and who is going to go. And I'm going to cull those animals that are consistently parasitized and need treatment over time. And then I may buy a really nice purebred male to bring in, some growth genetics if I'm selling, feeder animals. And then, that animal is really only going to see grass during the breeding season. Otherwise, again, they're more susceptible to parasites than those crossbred animals. And so we want to be careful that we take care of them. And so kind of wrapping up here, health programs are really about management. We want to prevent diseases. That is a much better way. Once animals get sick, sometimes our hands are tied on what we can do. It gets very expensive. Management is not always easy. But again, nutrition from overall health standpoint, not just parasites, nutrition is critical. Selecting healthy genetics. What is my goal, and what is my environment, and how do I match what I'm trying to produce with my environment, and finding those genetics that do both of those. And that can take some time, but it's doable. Again, decreasing stress. We want to pay attention to biosecurity, not just from a parasite standpoint, from other diseases. And then, yes, vaccinations are important, but really that's only touching a few of the diseases that we deal with. And so having that good nutritional basis, decreasing stress, is going to really allow that animal's immune system to work like it should. And then the final thing I want to cover is that taking care of our people's health is really important too. So there are some diseases that sheep and goats have that can be very detrimental to people. And particularly if you have immunocompromised population. So Q fever is one of those. That is, something that can be passed on. The animals can look perfectly normal, but they will shed a lot of that organism in the birthing fluids, even in a normal birth. And so that's just an example of, I'm not going to have pregnant women, children, or at least you're going to, have some protective, personal protective equipment, gloves, a mask, making sure you're washing hands, washing clothes right after you do a lambing or a kidding is really, really important, because we do not want people to get anything that these small ruminants can have. So that's actually all I have today. And if there's anybody out there with questions, I'm happy to take those. If anybody has questions that come up, always contact myself or Tyler. We're happy to help you in any way we can.
Absolutely. Thank you again, Dr. Navarre, for jumping on and giving us a good wrap up of this spring webinar series that we did. Like the others, this will be posted on YouTube for constituents and other people to see and find. And This was a great way to wrap up the series and have a lot of great information. So thank you again for coming out there, and just kind of echoing what Dr. Navarre said. If we could be any assistance to you in your small ruminant operation, please feel free to reach out to me. Either me, her, or any other extension agent in your respective parish. But with that, be looking for more things coming out in the fall and in the summer even. And we look forward to hearing from producers here soon. So I hope y'all have a great rest of y'all's weekend and Easter as well. So thank you again, Dr. Navarre.
Thank you very much.